A varicocele is an abnormal enlargement of veins in the scrotum, affecting up to 40% of men struggling with infertility. These veins, known as the pampiniform plexus, normally act as a cooling system, keeping the testes at an optimal temperature. But when the internal valves fail, sluggish blood pools inside the vessels, creating a congested network often described as a bag of worms. This stagnation leads to a shift in thermal balance. The adjusted temperature affects the entire region, altering the precise environment necessary for optimal cellular development. Under this heat-induced oxidative stress, sperm production drops, and healthy sperm suffer severe damage to their motility and morphology. The definitive solution is a microscopic subinguinal correction, highly sophisticated clinical procedure. It is designed to permanently buy and resolve the compromised vascular pathways. The procedure begins with a tiny, 2 to 3 centimeter incision in the groin, just below the external inguinal ring. Surgeons carefully isolate the spermatic cord and bring it to the surface, avoiding any direct trauma to the testicles themselves. A high-definition operating microscope is positioned, magnifying the surgical field up to 16 times to reveal the intricate microscopic anatomy. Through this intense optical magnification, the surgeon navigates a complex web of arteries, veins, and delicate lymphatic vessels. The first critical step is identifying and safely isolating the vas deferens, the vital tube responsible for transporting mature sperm. Next, the surgeon searches for the tiny testicular artery. Its subtle, rhythmic pulsation gives away its location amidst the swollen veins. Preserving this primary vessel is absolutely paramount. Maintaining this channel ensures the continued health and vitality of the entire glandular system. With the vital structures protected, the surgeon targets the dilated, malfunctioning internal spermatic veins, causing the varicocele. Using ultra-fine clinical threads, these dilated channels are carefully secured, successfully preventing the return of stagnant fluid to the system. The ligated sections of the malfunctioning veins are precisely divided. This meticulous process is repeated for every dilated vein in the plexus. By using microscopic precision, tiny lymphatic vessels are spared, preventing the post-operative complication of fluid buildup known as a hydrocele. With the swollen veins permanently blocked, the body's vascular system naturally redirects the deoxygenated blood to healthy, functional collateral veins. The internal structures are returned to their natural position, and the entry site is seamlessly restored. Recovery is efficient, allowing a swift return to daily activities. Internally, the physiological restoration begins immediately. Circulation patterns normalize, and the excess thermal energy dissipates from the reproductive environment. Freed from oxidative stress and venous congestion, the testis begins to heal. Healthy spermatogenesis rapidly accelerates. Within 3 to 6 months, millions of robust, highly motile sperm are produced, successfully restoring the patient's natural fertility. Explore the frontiers of medical science with us. Like, subscribe, and follow BioMatrix Education for more hyper-realistic surgical animations.